Diagnosis by 8 fundamentals. The diagnosis of cold heat. The dimension of cold heat concerns the nature of an illness. The presence of syndromes of cold or of heat reflects unbalanced excess or deficiency of yin or yang. Yin excess or yang deficiency manifests cold symptoms, whereas yang excess and yin deficiency manifests heat symptoms. For this reason, the Ming Dynasty physician Zhang Qingyue said, cold heat, they are the manifestation of changes in yin-yang. In differentiating cold and heat, it is not sufficient to judge on the basis of individual patterns of the symptoms. The physician must analyze the entire pattern of symptoms established by all the diagnostic methods in order to reach a firm conclusion. Symptoms of cold or heat reflect the nature of the illness. As a rule, cold symptoms include those that relate to coldness, and heat symptoms include those that relate to hotness. However, the symptoms of coldness can differ from the symptoms of cold, and similarly, the symptoms of hotness can differ from the symptoms of heat. The symptoms of coldness and of hotness are merely the apparent manifestation of the illness. In some situations, they may in fact be opposite of the cold or heat nature of the illness. In such situations, we may have true or false symptoms of cold heat. Thus, if the illness is one of cold but manifests some syndromes of hotness, it is a case of true cold with false heat symptoms. If the illness is caused by heat but manifests some symptoms of coldness, it is a case of true heat with false cold symptoms. But in the course of the majority of illnesses, the nature and the appearance of the illness tend to agree. That is, a cold illness tends to manifest coldness symptoms, and a heat illness tends to manifest hotness symptoms. Differentiation of cold heat is the basis for the selection of therapeutic principle and the choice of specific treatment. As the plain question states, if cold, warm it, and if heat, cool it. This clearly underscores the importance of cold heat differentiation to clinical therapeutics. Cold syndromes are those of illnesses of cold nature. Such illnesses mostly result from attack by exogenous cold, deficiency of yang or excess of yin or yang damage by chronic illnesses. Because of differences in the location of the illnesses, cold syndromes may be further categorized as symptoms of exterior cold or of interior cold. Cold syndrome in the exterior result from exogenous cold attacking the superficies and thwarting defensive yang. A typical pattern of clinical findings is the following: marked cold intolerance with mild fever, headache and body aches, absence of sweating, a thin white but moist tongue coating, and a pulse that is floating and tight. Cold syndrome in the interior results from exogenous cold directly invading the visceral organs or from deficiency of the body's yang qi, leading to the loss of its warming action. A typical syndrome of clinical findings is the following: cold body and limbs, a pallid complexion, bland taste with much saliva, polyuria of clear urine and loose feces, a pale tongue with white and moist coating, and a deep and slow pulse. Heat syndromes reflect hyperactivity of bodily functions. They result mostly from attack by exogenous heat, the passions transforming into fire, or yin deficiency and yang excess. With either strong yang heat or insufficiency of yin fluids to restrain yang, the bodily functions become hyperactive. As a result, the patient manifests hotness symptoms. Heat syndromes may also be categorized as exterior or interior. Heat syndromes in the exterior result from exogenous heat attacking the superficies. A typical syndrome of clinical findings is the following: fever with mild aversion to wind or cold, a dry mouth with mild thirst, a tongue with red tip and sides, yellow tongue coating, and a rapid pulse. Sometimes there may be an additional symptom of sweating or cough. Heat syndromes in the interior result from strong exogenous heat in the interior or endogenous heat arising from yin deficiency. A typical syndrome of clinical findings is the following: flushed complexion, fever, mental confusion and agitation, thirst with desire to drink, dark oliguria and dry constipation, a red tongue with yellow coating, and a rapid pulse. Thank you for your attention.